recent news article came out about a young girl who went to a routine chiropractor visit and became paralyzed shortly after. We are really hoping that she has a full and quick recovery. Unfortunately, this is not the only time this has happened. In fact, a study in 2013 reported over 700 cases of stroke after manipulation. That's 10 years ago, so sadly I'm sure some more cases have happened since then. In fact, there are even reported incidences of people passing away after manipulation. So today let's talk about whether getting your neck adjusted is really a good idea. My name is Dr. Shine Safar. I'm an orthopedic clinical specialist physical therapy, the owner of Unity Physical Therapy, and faculty of my graduate program. I'm also a professional stuntman, competitive martial artist, and pro breakdancer. And in my time as a clinician and myself as a professional athlete, I've had neck pain, I've got adjusted. And so today I want to discuss what the research shows on its safety and also its uses. This video is strictly for educational purposes so that we can all make some informed decisions. However, this should not substitute a medical exam. Everyone's case is different, and for you to get the best care that you deserve, you should be getting an evaluation to see how you can be served best. Now, let's get into this video and talking about what is a neck adjustment, also known as a cervical manipulation. Why do we do them, and how does it work? Cervical manipulations, neck adjustments, are high velocity, low amplitude mobilizations of the joints in the neck. Essentially what the provider is trying to do is do a quick stretch to a joint or multiple joints to improve mobility and even reduce pain. Now, it's not 100% certain how this works. There are some different proposed mechanisms. Some is that the joint is just locked and that capsule is being stretched. Others is that it's releasing some natural opioids in your body. Some of it that it's kind of tricking the nervous system. However, even though they carry a risk, they can actually be quite effective. Personally, I've had my neck locked up after jiu-jitsu. It usually would take about 2 weeks for this to resolve. During one of these episodes in graduate school, one of my professors who swore he doesn't need to put his hands on any patients and can just correct anything with exercises, pulled me aside, gave me a quick adjustment, and my pain went away immediately instead of the normal 2 weeks. And when we look into the literature, specifically the clinical practice guidelines about the American Physical Therapy Association, there is a B-level recommendation for manipulations with neck pain. However, this comes with an important distinction. As a physical therapist, there are a few considerations I need before I perform a high-velocity, low-amplitude mobilization. First, are they safe for it? Do they have any contraindications, precautions that I think about? And secondly, is this going to be something that the patient's going to benefit from? There is a list of contraindications against manipulations. A lot of them essentially tie into the idea of the bones not being very strong. And some of them also have to do with the vascular issue, which kind of goes into the risk of these neck manipulations. Secondly, are they a good candidate? Because, well, there's a lot of different reasons people can have neck pain and a lot of different presentations. Not everyone should be getting the same treatment. There's something called a clinical prediction rule, which is a set of tests that's helping me predict whether someone's going to respond well to this treatment in the clinic. In the case of neck pain, we really want it to just be a mobility deficit that they're going with, meaning it's not after a traumatic event such as a car accident. They're not showing signs of nerve involvement or disc pathology. It kind of looks more like when they have a stiff locked neck, and I have some tests that can help me distinguish whether it's a good idea to do something like this. More specifically, the author Pudendendula et al., I apologize if I'm saying the name wrong, created a clinical prediction that follows: positive expectations the manipulation will help, symptoms less than 38 days, cervical range of motion difference greater than or equal to a 10-degree side-to-side difference, and pain with PA spring testing with the mid-cervical spine. Now, I know that is a little jargon, and I'm not necessarily here to tell you how to diagnose that. It's just to show you that there is a set of tests that help me distinguish if someone's going to be a good candidate. What they found is that when someone has more than 3 or 4 of these, the chance of success that a manipulation will work shoots up from 38% to 90%. And the most important one really is that cervical rotation difference, because that's really cueing in us that's a mobility deficit. Although this can seem kind of nerdy, I think this is a really important point, because as medical providers, we need to be judicious in what we give to our patients. That means we should analyze and evaluate what our patients' needs are, and that's going to look different for everybody. Just like how if you went to your medical doctor, told them that you're feeling tired or that you're feeling something new and different, you would want them to run tests like a blood test or even imaging if they felt appropriate before they gave you a treatment. This is the same for physical therapy. Before I can treat someone or give recommendations, I need to have a really thorough evaluation. Otherwise, I'm just shooting in the dark. And instead, if we just spend the 15 to 30 minutes of a really good exam, we can probably get results much faster. The evaluation always lets me know how I can serve someone best. Are they someone that needs one of these high velocity, low amplitude mobilizations? Or is it exercise? Is it hands-on treatment? Is it movement correction? Or is it even a referral to a medical doctor because I think something else is going on? Just giving them a cookie cutter template to just pop and go is not doing anyone any favors. So now that we've shown that it can be effective and we do actually have a recommendation for using it in certain populations, let's talk about the risks. There are a few different studies that extrapolate the data on the risks of something happening after manipulation. The thing that we're usually worried about is a stroke because the vertebral arteries get dissected, meaning the arteries that run up your cervical spine can get irritated to a point of causing a stroke in your brain. Some studies have quoted the risk of this to be as low as 1 in 5.85 million. However, there are some studies that can show that it's as high as 1 in 958. And in some of those studies that show that it's less risky, the authors of those studies have been on the chiropractic board. Regardless of the exact number, there are many cases of adverse effects happening after this. There is a real risk to doing this. However, there is a risk to almost everything, including medication, surgery, exercise, and even doing nothing. So, where do I stand? I personally believe it is a technique that can be used, but I do have to check and make sure that patient is a good candidate for it. Do they have any contraindications, precautions, and do they fit that clinical prediction rule that shows it's actually going to help them? Always doing a good analysis before will lead to better results, and I don't think anyone's arguing with that. Now, if you noticed, one of the factors for that clinical prediction rule is a positive expectation this will help, and a lot of people don't want this. The good news is there's alternatives. One is, instead of doing a manipulation to the cervical spine, you can actually do to the thoracic spine, the rib cage, and have less of a worry of that stroke because of the vertebral artery dissection. The other is you can do lower grade mobilization. So these are just softer versions of doing the same thing without that quick, intense maneuver. And lastly is even corrective exercises. You can kind of accomplish the same thing, it just might take a little longer with some corrective exercises. Now lastly, I promised in the beginning of the video that I would share a tip with you that could help save someone's life. And since we're talking about strokes after manipulation, I want to share a FAST tip with you. No pun intended, because the tip is FAST. It's the acronym FAST. And in this case, FAST is an acronym that helps us detect a stroke so that we can get the necessary treatment. The F stands for facial drooping, the A is for arm weakness, the S is for slurred speech, and the T is time to call 911. Share that with your friends because that could save someone's life. I hope you enjoyed the video, and please subscribe for more videos on performance, wellness, and injury prevention. Follow us at Unity PT LA or go to our website at unityphysicaltherapy.com. Thank you so much and have a great day.